If you've been dealing with persistent itching in a specific area, even after applying creams and medications, it might not be a skin issue at all. It could be a silent warning from an underlying health condition trying to make itself known. It might sound harmless after all. Who hasn't felt itchy from time to time? But in older adults, an itch is no longer just an itch. It could be your body's way of sounding the alarm that something inside isn't functioning quite right. Perhaps a nerve is being compressed, or worse, a chronic disease is quietly forming without your awareness. The scary part is this: many people simply assume it's probably dry skin, ignore it, and by the time it gets serious, it's often too late. A persistent itchy spot on the skin could be an early sign of diabetes, a warning about poor circulation, a symptom of a fungal infection or neurodermatitis, or worse, a distress signal from your nervous system, liver, kidneys, or immune system. In today's video or article, you're going to discover 10 itchy spots on the aging body that should never be ignored and what each one might be trying to tell you. These aren't just patches of irritated skin, they're clues from within, signs your health might be trying to speak to you. 1. Itchy scalp. It might not just be dandruff. An itchy scalp is one of the most common complaints among older adults and also one of the most frequently ignored. Why? Because we often blame it on the weather, shampoo, dandruff, or just dry skin. But if you've already switched products, moisturized properly, and the itch still persists, it's time to listen to what your body is trying to say. For older adults, an itchy scalp isn't just about dryness. It could be a sign of seborrheic dermatitis, a chronic skin condition that causes redness, flaking, and burning itchiness, especially in areas rich in oil glands, like the scalp. It's often mistaken for regular dandruff. Fungal scalp infections. Fungi thrive in moist environments, especially if you often wear hats or don't wash your hair properly. Delayed allergic reactions to shampoos, hair dyes, sprays. Even if you've used the same products for decades, your skin becomes more sensitive with age, turning familiar items into unexpected irritants. The problem is that we can't see our own scalps easily. Often, we only notice when flakes land on our shoulders or when hair starts falling more than usual. If left untreated, scalp issues can lead to widespread infection, patchy hair loss, persistent itching with burning, disrupting daily life. What should you do? If your scalp has been itching for more than 1 to 2 weeks, see a dermatologist. Don't self-medicate with random creams, it might make things worse. Choose a gentle, fragrance-free shampoo, preferably one formulated for sensitive skin or recommended by doctors. Avoid scratching hard. Each scratch may damage the skin and open the door for bacteria or fungi to invade. Itchy scalp may seem like a minor issue, but it can be the gateway to a series of bigger health problems if you ignore it. Listen to your body early, make the right adjustments, and you'll be taking a smart and proactive step in protecting your overall health. 2. Itchy eyelids. Don't just blame it on allergies. Have you ever felt a constant, tingling itch on your eyelids, especially in the mornings? Or maybe you often rub your eyes, feeling like there's something stuck inside? If this happens regularly, it could be a sign of a condition called blepharitis, a common but often overlooked issue among older adults. Blepharitis happens when the oil glands along your eyelids get blocked or inflamed, causing bacteria to build up and lead to swelling and itching. Dirt, makeup, or moisturizers accumulate around the eye area, causing irritation, especially if you don't clean off cosmetics properly. There's an allergic reaction to mascara, eye creams, or even prescription eye drops. It might start as a minor itch, but if left untreated, you could also experience red, watery eyes, sticky discharge that makes your eyelids stick together in the morning, a gritty, sandy sensation in your eyes, temporary blurry vision, or even a higher risk of conjunctivitis or corneal infection. The skin on your eyelids is the thinnest on your entire face. Any irregularity here should be treated as an early warning sign from your eyes. What should you do? Don't rub your eyes. Bacteria from your hands can make it worse. Gently clean your eyelids every day with warm water and a cotton pad, or use a designated eyelid cleanser. You can apply a warm compress for 10 to 15 minutes daily to unclog blocked oil glands. If symptoms last more than a week, see an eye specialist for an accurate diagnosis and treatment plan. Itchy eyelids might seem like a small matter, but when you're at an age where your vision is more fragile than ever, every signal counts. Your eyes are the windows to your soul, and your eyelids are the very first defense line worth protecting. 3. Itchy hands more than just dry skin. We use our hands for nearly everything: cooking, dressing, holding things, even personal hygiene. But what if one day your hands start itching persistently, feeling dry, tingly, or even slightly painful? Don't just assume it's a lack of moisture. For older adults, itchy hands can be an early warning sign of deeper health issues. Here are the 3 most common culprits behind itchy hands in older adults. 1. Contact dermatitis. Caused by your hands coming into contact with irritants like soap, cleaning products, dye chemicals, dishwashing liquid, or even metals and jewelry. Symptoms: redness, rash, peeling, and itching, either spreading widely or appearing in patches. 2. Carpal tunnel syndrome. Happens when the median nerve in the wrist gets compressed. Symptoms: itching along with numbness, weakness, tingling like pins and needles, especially at night. 3. Early signs of diabetes. When blood sugar levels stay high, the skin on your hands can become dry, inflamed, and consistently itchy, often paired with symptoms like excessive thirst, fatigue, and unexplained weight loss. Ignoring a small itchy patch on your hands can lead to skin infections from scratching, reduced grip strength, a drop in quality of life due to difficulty performing everyday tasks. What should you do? If you use cleaning products, wear gloves. Choose powder-free and latex-free ones if you have sensitive skin. Moisturize your hands daily, especially after washing and before bedtime. If you feel numbness, weakness, or long-lasting itching combined with fatigue, get a blood sugar test and consult a neurologist. If the itching has no clear cause, don't self-medicate. The wrong cream might worsen the condition. Your hands don't just help you touch the world, they're one of the first places your body sends distress signals from the inside. And if you know how to listen, you'll have a firm grip on your health. 4. Itchy feet. When your feet speak before your heart or diabetes does. A little itch on the soles of your feet or between your toes might seem harmless. Maybe your shoes are too tight or it's just hot outside. But if that itch persists, comes with peeling, redness, cracks, or slight swelling, it might be much more than just a temporary irritation. The feet are often the first place to show signs of poor circulation, fungal infections, or complications from diabetes. Most common cause? Athlete's foot, tinnitus. A warm, damp environment, like wearing closed shoes all day or sweaty socks, creates the perfect place for fungus to grow. Signs: burning itch, peeling skin, cracked spaces between toes, and sometimes an unusual odor. If left untreated, those small cracks can become open doors for bacteria, leading to cellulitis or even blood infections. But it's not just fungus you should worry about. 1. Diabetic neuropathy, nerve complications from diabetes. Diabetes can damage peripheral nerves, causing itching, burning, or numbness. One of the earliest signs might be just a mild itch on your feet. If you already have diabetes, you must take this seriously. 2. Poor circulation, common in older adults. When blood doesn't flow well to the legs and feet, the skin can become dry, itchy, and even swollen, especially in the evenings. If left unchecked, it can lead to peripheral artery disease, PAD. What should you do? Wash your feet daily, especially between the toes, and dry them thoroughly. After washing, apply foot cream if your skin is dry. Avoid going barefoot in public areas, gyms, shared showers. If you have diabetes, inspect your feet daily to catch cuts or infections early. If you experience long-term itching plus peeling or itching plus numbness, see a doctor before it becomes a wound you can't ignore. Your feet carry the weight of your whole body, but they're also the farthest from your heart. That's why problems inside your body often show up at your feet first. So if your feet have been persistently itchy, don't brush it off. Your body might be trying to tell you something important. 5. Itchy back, the silent zone that speaks volumes. The back, you can't see it, you can't easily reach it, and most of the time, no one pays attention unless it's really itchy. But if you frequently feel itching in the same spot on your back, especially with tingling, stinging, or mild pain, your body might be trying to tell you something important. Here are some silent but serious causes of back itch. 1. Shingles, herpes zoster. This is the reactivation of the dormant chickenpox virus in your body. It often begins with itching, burning, or tingling on one side of the back, followed by a red rash that turns into blisters. If not treated early, shingles can lead to postherpetic neuralgia, a painful nerve condition that lasts for months. 2. Notalgia paresthetica. Ever heard of it? It's a nerve condition caused by compression of small nerves in the upper or mid-back, often near the shoulder blades. Signs include long-lasting itch in one specific area, no visible rash, creams don't work, and it may come with tingling or mild burning sensations. It's not a skin condition, it's a nerve issue in disguise. 3. Severe dry skin, due to aging or environment. The back is one of the hardest places to clean and moisturize well, especially in cold climates or air-conditioned environments. The skin here becomes prone to extreme dryness, leading to persistent itching. What should you do? If you've had an itchy spot on your back for weeks, don't guess, consult a dermatologist or neurologist. Suspect shingles? The sooner you see a doctor, the better. Antiviral meds are most effective within the first 72 hours. Moisturize your back daily. Use a long-handled applicator or ask someone to help after showering. Avoid scratching aggressively. This can leave dark scars or cause secondary infections. The back may be out of sight, but it should never be out of mind, especially when it comes to your nerves, immune system, or hormonal health. If itch creams aren't working, it's time to stop guessing and start investigating. 6. Itchy arms when your skin's tolerance isn't what it used to be. Have you ever felt a tingling itch on your arms, especially on the outer side or near your elbows? You scratch, apply some lotion, feel slightly better only for the itch to return the next day. If this pattern keeps repeating, it's likely not just dry skin. In older adults, the arms often reveal some of the clearest dermatological reactions and sometimes signs of vascular, neurological, or allergic issues. Possible hidden culprits behind that persistent itch. 1. Recurrent atopic dermatitis, eczema. Though common in children, many people experience flare-ups again in older age when the skin becomes thinner, drier, and more sensitive. Signs: red, flaky skin, small or large patches of rash, and intense itching, especially in cold weather or during stress. 2. Reactions to detergents, medications, fragrances, or synthetic fabrics. The older we get, the more reactive our skin becomes even to products or materials we used to tolerate. Sweaters, strong scented laundry detergents, or old sunscreen formulas could all be secret itch triggers. 3. Mild circulatory issues. If the itching comes with cold hands or feet, frequent bruising, or increases at night, it may be due to reduced blood flow to your arms. What should you do? Avoid hot water when showering, as it strips the skin of its natural moisture and worsens irritation. Limit wearing synthetic fabrics like polyester or wool blends if your skin is sensitive. Moisturize your arms regularly, especially right after bathing. If you notice long-lasting redness, persistent rash, or patches of hardened or darkened skin, see a doctor to rule out chronic dermatitis or allergic skin reactions. Itchy arms may not seem like a big deal at first, but they can be a quiet whisper from your skin saying, "I'm not coping as well as I used to." A little more care and a gentler approach can go a long way toward keeping your skin calm and comfortable. 7. Itchy lower legs. Not just dryness, but possibly poor circulation. Have you ever noticed that your lower legs from the knees down often feel itchy, especially in the late afternoon or evening? The skin feels tight, dry, and you just want to keep scratching, even though lotion only helps a little. If this keeps happening, it might not be just dry skin. It could be a warning sign that your lower limb circulation isn't functioning well. Magnifying glass deltoidrite. Here are some common causes behind persistent lower leg itch. 1. Poor circulation. When blood doesn't flow efficiently to the legs, the skin doesn't get enough oxygen and nutrients, making it dry, itchy, and sometimes discolored. Other signs include cold feet, numbness, heaviness in the legs, or visible bluish veins. 2. Varicose veins. When leg veins become weakened, blood pools in them, causing swelling, heaviness, itching, and sometimes a burning sensation. You might even notice twisted, bulging blue or purple veins beneath the skin. 3. Chronic dry skin, xerosis. Many older adults skip moisturizing their shins, which leads to flaking, cracking, and that creepy crawly itch that lasts all day. What should you do? Elevate your legs for 15 to 20 minutes daily, especially after walking or standing for long periods. Use a rich, fragrance-free moisturizer on your lower legs, ideally after bathing. If you've been diagnosed with varicose veins, wear compression stockings as advised by your doctor. If your leg skin is darkening, veins are prominent, bruises appear easily, or the itch just won't go away, visit a vascular specialist early to prevent serious complications. Itchy lower legs aren't just annoying, they can be your body's first signal that something deeper is going on with your circulation, blood pressure, or vascular system. Don't let a minor itch turn into a major issue. 8. Itchy chest or abdomen. When the skin's surface reveals what's beneath. Itching on the chest or abdomen often gets brushed off as something simple. Maybe your clothes were too tight, you sweated a bit, or your skin's just dry. But if you've already switched to loose clothing and gentle body wash, yet still feel a constant tingling itch around the center of your chest, your sides, or belly button, it might not just be skin deep. Here are some potential hidden causes of that mysterious midsection itch. 1. Systemic allergies or dermatitis from medication, food, or skincare. This is your immune system reacting negatively to something you've ingested or applied. Accompanying symptoms: widespread itching, red bumps or rash, a warm or flush sensation. It can happen shortly after taking a new medication, eating unfamiliar foods, using new creams, or switching laundry detergent. 2. Hormonal imbalance or poor liver function. When the liver isn't working properly, toxins may build up in the body and cause deep, lingering itching under the skin, often without any visible rash. This is common in those who take multiple medications, have a history of liver/gallbladder issues, or are postmenopausal. 3. Neurodermatitis or stress response. Emotions can directly affect your skin, especially around the chest, where many sensory nerves lie. Itching may feel like it comes and goes, or worsens with stress and fatigue. What should you do? If you've had chest or abdominal itching for over a week, even with moisturizers, don't ignore it. Track other factors like food, meds, and recent changes in skincare. Wear loose, breathable cotton clothing. Tight or synthetic fabrics can worsen the irritation. If you suspect liver involvement, e.g. yellowish skin, fatigue, poor appetite, ask your doctor about liver function tests. Don't take antihistamines or apply strong creams without knowing the exact cause. It could mask the real issue. Itching on the chest or belly isn't always a surface problem. Sometimes, it's your body whispering that something deeper needs your attention. And if you tune in early enough, you can respond before things escalate. 9. Itchy private area, when the unspoken zone deserves serious attention. Among older adults, especially postmenopausal women and men with chronic conditions, itching in the private area is common, yet often ignored. Why? Because it's a sensitive topic. But here's the truth. The skin and mucosa in your intimate area are extremely delicate. Persistent itching there might not just be a nuisance. It could be an early warning of infections, hormonal imbalances, or even metabolic or immune issues. What are the most common causes of itching down there? 1. Fungal or bacterial infections. In women, the most frequent culprits are Candida yeast infections or bacterial vaginosis. In men, it might be balanitis, inflammation of the foreskin, or a urinary tract infection. Signs: itching, burning, unusual discharge, strange odor, or a stinging sensation when urinating. 2. Hormonal decline, especially in postmenopausal women. As estrogen levels drop, the vaginal lining thins and dries out, making it more sensitive and prone to irritation. May be accompanied by painful intercourse or prolonged discomfort from wearing underwear. 3. Allergic reactions to hygiene products, detergents, or even sanitary pads. Some products, even ones you've used for years, may start triggering contact dermatitis in this area due to fragrances, foaming agents, or rough materials. What should you do? Gently wash the area daily with warm water and a mild, pH-balanced cleanser. No deep internal washing or douching. Avoid tight, synthetic underwear. Opt for breathable cotton fabrics that allow ventilation. Do not self-medicate with creams or suppositories. Every infection requires a specific treatment. If symptoms last more than 3 days or keep coming back, see a gynecologist for women or a urologist for men. Itching in the private area isn't just a little embarrassing, it's a clear health signal. And the earlier you respond, the fewer hidden problems you'll have to face down the road. 10. Itchy lower abdomen and hips, when your body sends a subtle SOS. Ever felt a strange, tingly itch on your lower belly, sides, waistline, or near your navel, with no rash, no redness, just an odd, deep sensation? If that itch lingers for days with no obvious skin symptoms, don't brush it off. It may be your body's way of waving a red flag. Here are 3 common culprits behind these mysterious itches. 1. Early-stage shingles, herpes zoster. Shingles often begins on one side of the body, commonly on the lower abdomen, back, or hip. The early signs? Just an itch, tingling, or burning sensation. The rash and blisters may appear days later. Early detection is crucial. Antiviral medications work best within the first 72 hours, reducing both symptoms and long-term nerve pain. 2. Nerve compression from spine or muscle issues. When nerves in the lower back are compressed due to spinal degeneration or a minor disc herniation, you may feel a deep itch, numbness, or heat on the skin over your hips or belly. This isn't a skin condition, it's a sensory reaction from irritated nerves. 3. Allergic reaction to belts, tight clothing, or lotions. The lower belly and hip area often come into contact with waistbands, belts, and thick fabrics. New body washes, detergents, or long-term tight clothing can trigger contact dermatitis, even if your skin looked fine with them before. What should you do? If you feel a persistent, one-sided itch on your hip or lower belly with a tingly or burning sensation, look for small red patches or blisters and get checked for shingles immediately. Avoid tight clothing or stiff fabrics that rub against the skin. Let your skin breathe. If the itch is paired with deep aches in your lower back, or the itch travels down one side, consult a neurologist or spine specialist. Moisturize your abdominal skin daily, especially in dry climates or air-conditioned environments. Remember, itch isn't just a feeling, it's a message. Sometimes, that stubborn itch is the first doorway to deeper health issues you never saw coming. By listening to your body, even in the smallest signals, you're taking the smartest step towards staying healthy, proactive, and in control every single day. And if you or someone you love has been dealing with mysterious, long-term itches, don't ignore it. Take a little time to get it checked, or simply ask a health professional. And if this info helped you, share it. A timely message might just help someone catch a hidden illness before it gets worse.